Dental implant procedure is basically replacing missing teeth. So if a patient comes in, they either have broken teeth that need to be removed, or they have gaps because teeth have been extracted when they were a kid or a young adult, we can now replace a lost or missing tooth with an implant. The implant itself is a titanium screw that gets placed into the jawbone, and it mimics the roots of natural teeth. And then once that's done, we then attach a crown to the implant, and it basically stabilizes that area that has been destabilized with a missing tooth. Now a patient can eat and function and, have a tooth that was missing replaced. When a patient comes in for implants, the first thing that we do is we take a 3D image of the actual jawbone. We send that to a laboratory. That laboratory basically in a 3D CAD/CAM program places the implant into the jawbone based off of the CT scan that we sent them. After they do that, they make us a 3D printed surgical guide that is sent back to me. And at the time of surgery, I place that surgical guide in the mouth where it has a hole where the implant is to be placed. The implant is then drilled through that hole and placed into the jawbone. And then if it's a lower jaw, we then wait 4 to 5 months for that bone to heal into the implant. If it's an upper implant, we usually wait 6 months because the bone quality is more porous, so it's less dense, and the torque and stability takes longer to be achieved on the upper jawbone versus the lower jawbone, which is more dense, and we can then place crowns on the lower jaws a little bit faster. So about 4 months, we can place a crown onto the implant on the lower jawbone, and in about 6 months, we can place a crown on the implant in the upper jaw.